been the biggest thing, has been the mental health inside. So they're not following the law and the regulation in terms of providing the access centers, but they've been making veterans go thousands of miles or not get, literally fly them across the country or you don't get mental health inside, or making them wait months. And so a lot of veterans, the suicide rates have been going up because veterans have not been able to get the care. When someone is suicidal or someone needs residential, they need it right then. And practitioners tell me that if veterans could get it immediately, whether it's at VA or in the community, that the suicide rate would go down in half. That's what practitioners do. So in the law is like, hey, you already have the authority through access standards and best medical interests to take care of veterans immediately who need immediate residential, like the example I gave you, mental health inside. So one of the most important pieces in there is like, hey, you have 48 hours, VA, to make a determination once you know about it.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, and welcome to the American Potential Podcast. I'm your host, David Fromm. You know, when someone chooses to defend America, we have the responsibility to take care of them when they come home. A key part of that is making sure their healthcare needs are met. Whether it's providing prosthetics, helping them navigate PTSD or chronic pain, accessing medical services should never feel like another battle for a veteran. But too often, it does. Because of long wait times, canceled appointments, or having to drive hours for an appointment, that type of system doesn't work for veterans. That is why Congress is having to build on the positive momentum of the 2018 Mission Act by introducing the Veterans Access Act. I want to welcome back to the podcast Darin Selnick, who is a senior advisor for Concerned Veterans for America, to talk about what the Veterans Access Act will do. Darin, welcome back. How are you?
Thanks, David. I'm great. It's great to be back on your show.
Awesome. Well, I'm glad we're talking about this topic. I'll be honest with you. I've been around AFP. I've said 14 years almost, and I've watched Concerned Veterans for America and the great work that they've done, working with our allies in Congress and elsewhere. But it's one of these super frustrating things, though, that who doesn't want veterans of all people to get the healthcare access that they need? And it's just unbelievable. And we thought the Mission Act would be so, is transformative, and it is a great thing. But man, the fact that we have to now continue to push with the Veterans Access Act is really kind of frustrating and mind blowing when we look at what's at stake. So, since we already have the Mission Act, why do we need to pursue the Veterans Access Act?
Great question. And theoretically, we shouldn't need the Veterans Access Act. But unfortunately, and look, for your audience, I helped create it in the Trump administration, and I negotiated it, and I implemented it. And then after the Trump administration came back to CVA, and year by year, step by step, we saw the Biden administration purposely, willfully not follow the law, not follow the regulation. And that may be abstract to people, but here it was hurting and literally killing veterans. Let me give you two examples, because there's FOIA documents we've seen, there's reports we've seen from the VA, but it's the veterans themselves, the stories that really got us going on having to create that. So, for example, there was a veteran who was homeless. He needed to have substance abuse treatment, residential. He had actually stole money from his own family for his abuse, this typically like PTSD and stuff like that. So the VA wouldn't deal with them. And a community care provider who's under contract with the VA called me with him and said, what do we do? The VA on the phone wouldn't even deal with the veteran. I said, take him to the emergency room. We went to the emergency room. They saw him. And immediately they said, yes, this veteran needs residential substance abuse now, homeless, etc. But we don't have a bed for at least 30 days. I said, hey, we have a community care partner who's under contract who has a bed now. They said, well, our policy, which is opposite of the Mission Act and the regulation, is that we're not going to allow community care for mental health and for substance abuse residential. So here's what we'll do. We will give the veteran an Uber to a homeless shelter to wait there until we have a bed sometime post 30 days. Well, the veteran could be dead by then. And they know, and everyone else knows, that if you have someone that's in that bad of shape, that's homeless, been kicked out by the family and needs immediate treatment, that you give them immediate treatment. If the VA doesn't have the ability to do it and you have a community care, you do that. But they literally, and I actually got involved with the staff on this, they literally wouldn't budge. So the community care provider gave them a scholarship, free, so that veteran wouldn't die. Another quickie example is just on the absurd, but these are not one-offs. It's the problem. There was a blind veteran in Louisiana who was seeing community care provider because he was blind, and the closest medical center to him was over 60 miles away. And the VA said, no, our new policy is to try to make sure all the veterans come back to our facilities and to stop community care, despite the law and the regulation. So blind veteran who's 60 miles away from us, you have to now drive 60 miles to us rather than stop seeing that community care provider, which is right down the street. It's like, wait a minute, he's blind. Do you not get the fact that he's legally blind? He can't drive. And he's elderly, and his wife had eyesight problems and couldn't drive either. So finally, after a lot of muscle and time and attention, we got that fixed. But these are things that shouldn't be happening. Also, we've seen veterans who are cancer patients delayed 8 months after the VA diagnosed the cancer before they would get the referral for the oncologist. And by that time, the cancer doctor said, too late, hospice, and the veteran died 2 months later. So these are things that should never happen. This is what we had in the Mission Act. But in a red team report, which came out that the VA did in 2024, early 2024, and through the FOIA documents, where they specifically have instructions not to tell veterans they have community care. They even had documents to the VISN directors. These are the regional medical directors saying, it's in your performance report to stop community care.
Oh my.
So these are the things.
So the incentives, the incentive is to stop community care if that's in your performance report.
Yes. And look, you don't get your performance report if you have too much community care. The incentive is to stop it. It's in your goals. It's in your actions. How do we know this stuff? Because good employees at the VA contact me good clinical doctors, nurses, social workers. They don't want a veteran at a homeless shelter. They want a veteran being taken care of. And so what has happened is, under the Biden administration, VA went to the institution first at all costs and the veteran second. And so under a new administration, the Trump administration, they are correcting this. But, there are no political appointees in VHA right now. Zero. So it's been kind of on autopilot. And ultimately, VA could fix this on their own. But here's the problem. It was fixed last time. So unless we put extra stuff in the law, which may not stop them, but which is a deterrent, unless you put extra stuff in the law, even if the VA gets fixed under this current administration, which hopefully we'll get a new undersecretary of health soon, that we're worried about the next administration and the next Democratic administration going back to its old ways in doing it. So we could say, hey, we're going to make it as hard as possible to not follow the law by putting additional benchmarks, safeguards. And that's what we've done. And that's why we created the Veterans Access Act.
So maybe take us through what the Mission Act did, and then what would the Veterans Access Act do? Right.
So good question. So with the Mission Act, we, for the first time, made permanent in the law veterans' choice and safeguards to that. So, for example, if you were too far away or the wait was too long, say for primary care mental health, a 30-minute drive or a 20-day wait, specialty care, a 60-minute drive or a 28-day wait. And look, we borrowed these from DOD. So they've been in practice in DOD for like 25 years, and they work very well. But those were the no worse than. So let's get that, open the door for choice. A veteran didn't have to go. If he really liked his VA facility and wanted to drive extra, wait extra, it's on him. And it could happen. I mean, look, people wait longer and drive farther to go to the Mayo Clinic. So if you're really good, people will do that. We wanted to make sure that it would be their choice. And so we put in the access standards so that it would absolutely be their choice. And then if they had other issues where they were really close to a medical center, but they needed a specialist heart surgeon that the VA didn't have, we had best medical interest. And of course, if you didn't even have a full service medical center like in Alaska or New Hampshire or Hawaii, then you had full choice. And we also made sure you had full choice for urgent care. So if you had an urgent care situation, you could just go to any provider in the network and do it. So those things were working well. And of course, that was an incentive for the VA facilities to do better on their own wait times and their own customer service, so that veterans would want to stay with them and not go somewhere else. Unfortunately, with the FOIA documents, like we said, that we've seen, they stopped following that. And so that's why we did the Veterans Access Act. Number one, the previous administration was trying to undo the access standards so veterans wouldn't have a choice anymore. So they were going to change them. Matter of fact, I heard recently that they'd actually gotten it to OMB, a draft regus. If they had won re-election, they were going to do that. So we want to make sure that the access standards are in the law and codified so that a future administration can't undo them. And of course, they can do better, but they can't do worse. Same thing with best medical interest. We had put in there, and through the Dole Act, we had gotten that if the doctor and the veteran decided it was in their best medical interest, that was it. In the previous administration, they were like taking it to administrative boards and secret referral coordination teams and literally undoing it. So we fixed that, but we wanted to make sure in this legislation that actual conversation actually takes place between the doctor and the veteran, and the veteran's preferences, how they want it, when they get it, and stuff like that is taken into consideration. And then some of the things are so common sense, you would just say, how could you do that? For example, what they were doing was not telling veterans they were eligible. So veterans didn't know they were eligible for community care, and they had in their rules, don't tell them unless they ask. So we say, hey, if a veteran's eligible, you're going to have to tell them. You're going to actually have to tell them. And then if they deny veterans care, what they were doing was that they were saying, hey, we're not telling them that we're denying them care. So veterans would be in limbo. So now in the law, we're saying, hey, you're going to actually have to tell them when you're denying them so they can do an appeal, because they have an appeal process. You don't deny them. How do they know they're being denied? How can you appeal if you don't know you're denying? Pretty common stuff. And then most sophisticated medical groups and DOD have where you can go online, you can do online appointments, you can check where your authorization is, you can check where your estimate of benefits are. So if you got a bill, you know what you actually owed, where your medical claim is. This is common stuff. VAs refuse to do that. So this bill is making them go ahead and do the simple online self-service functions that everyone else has. And probably one of the most important ones that comes underneath here, but it's been the biggest thing, has been the mental health on the side. So they've not been following the law and the regulation in terms of providing the access centers, but they've been making veterans go thousands of miles or not get, literally fly them across the country, or you don't get mental health side, or making them wait months. And so a lot of veterans, the suicide rates have been going up because veterans have not been able to get the care. And when someone is suicidal or someone needs residential, they need it right then. And practitioners tell me that if veterans could get it immediately, whether it's at VA or in the community, that the suicide rate would go down in half. That's what practitioners tell me. So in the law is like, hey, you already have the authority through access standards and best medical interest to take care of veterans immediately who need immediate residential, like the example I gave you, mental health inside. So one of the most important pieces in there is like, hey, you have 48 hours, VA, to make a determination once you know about it, that a veteran is a priority, that they need residential mental health inside now. And then you've got 48 hours after that to get them placed. Either you can place them within the access standards close by at the VA, or you place them within a community care provider. And then if, of course, they're not priority, that means that they do need it, but they don't need it in the near future. But although most would probably need it immediately if they're identified, than the regular access standard. So it's very prescriptive. No more can you give them another. One of the things they would do is say, hey, we don't have that mental health that they clinically need, but we'll give them this instead, which wasn't the same thing. And then a lot of veterans refuse because they're like, I don't want to do group therapy. I need individual therapy. Those sorts of things. And so these are the common sense things. And there's other good things in there as well in terms of making sure the claims are paid. But these are kind of like the top line, most important things of making sure veterans have accurate wait times. They know when they're eligible, that they have access to it, that if they're denied, they can appeal, and they can get their mental health in a timely fashion and the VA can't wiggle out. All these things VA was doing in their own documentation and their own training to protect the institution, because too many veterans wanted community care because they were being treated better in the community than they were being treated at the VA.
So community care seems to be one of the really important items here.
Right.
And first of all, maybe can you tell us why it's so important? I think it's a little self-evident, but I think why it's so important. And then why in the world are the bureaucracies or the Biden administration or anything, like, trying to kill it and trying to stop people from accessing it? It's unbelievable.
Well, no, two very important questions, because I get the question all the time. There's good VA hospitals and bad VA hospitals, good private sector and bad private sector. So what's the difference? The difference is the VA is basically one of the last vestiges of government-run, socialized type healthcare, which is fine in a sense that if that was a option for you and you wanted to do that option. VA does a number called the reliance number, and it says for most veterans who use VA have other health insurance, 84%. And so they have a survey and they say, how much do you use VA versus how much do you use your other health insurance? The average veteran who uses VA for about 38% of their care, and they use your other health insurance for about 62%. Now, understanding VA is basically free to them, and we all know other health insurance can be very expensive. So for the most part, they choose for 2/3 of their health care to go outside of VA, even when it's free, because of the problems with it. And so the difference is, if I'm on the outside and I have a bad hospital or a bad doctor, I have the choice to pick somebody else. And so if I call my dermatologist and my dermatologist suddenly has a 2-month wait time, I can decide to wait, or I can say I don't want to wait, and they'll find me another dermatologist in the practice, or I can find another practice which doesn't have it. And so I do this all as a TRICARE Prime patient. The system works really well in terms of the community, in terms of the VA facility, and they don't try to do these things. And it happens all the time. So I just call for a dermatologist. You can see right here. Last week on a Monday, actually, and I called my private care dermatologist, and they said, hey, if you want to go to this particular facility where he's once a week, it's going to be like 5 weeks, or we can get you in 3 days at this other facility, which is a little further drive. So I picked a little further drive. I waited 3 days rather than a month. And I was there, and of course, then I got cut up. But that's the way it goes. At the VA, you don't have that option. At the VA, they pick the doctor, they pick the hospital, and you have no other option. And so that's why community care is valuable, because in the private sector, if I don't like it, I can pick another doctor, I can pick another hospital, I can pick another provider, I can pick another plan. But at the VA, I'm stuck. And so that is the problem. You are stuck. And if you have good healthcare, you have good healthcare. So you don't, and then you're stuck with your bad healthcare. That's the difference. Now, why are they doing this? It's sad, but management cares about the money and cares about protecting them. And what they're afraid of is too many veterans leave the system and go in the community, that they would have to go ahead and start downsizing. But they should. Because if your patients don't want to see you, and you're a bloated, fat bureaucracy, you need to become more efficient. And so ultimately, choice is what will make them more efficient, because if the dollars follow the veteran and not stay at the facility, no matter how few veterans they have, then they have to clean up their act, or they will have to downsize. But they care more about that than they care about the veteran getting care, which is for the VA, which is only about taking care of veterans. And which has on their Omar Bradley statement about, taking care of the veterans first. And Abraham Lincoln, his statement about to care for those who are born in the bad ones, for the widow and orphan. It's very sad that the United States government, VA, career management care about dollars and say in their power and their money, and not about the veteran. It's very sad.
Yeah, I think you're being kind saying it's sad. I think it's almost downright evil at times. I mean, it's certainly wrong. These are folks who often were injured physically or mentally in service to our country. We asked them to go do it. And then, and the folks who have given years of their lives, portions of their body. I mean, there's a lot of, just, and have truly, truly sacrificed for our freedom, for our country's well-being. These people should be the front of line. And they should be receiving some of the best healthcare and have some of the most access, because our entire motivation should be to get them what they need, because service to us is one of is the main reason why they need the care oftentimes. And especially to me, the one that really blows my mind is going back to the mental health services, and how, we've seen such an epidemic of suicide amongst veterans, and just severe mental health difficulties. And we know that treatment of that really improves outcomes so much more. I think you mentioned that already. And the idea that we're not intervening on that with everything that we can do. You look at when there's an epidemic medically, we flood the zone and try to do whatever we can to stop that from spreading. And here we're putting up bureaucratic walls and making them stand in line, and people are dying in that line because they're taking their lives, and it's just unbelievable. It really makes me angry. And I think a lot of voters, and I know CVA is bringing this message to people, but I think a lot of Americans, if they really saw exactly what's going on here, just get really angry about it, because it seems really anti-American.
Well, they do. And I get really angry. People say, Darin, why you've been in the fight for such a long time. Why do you stay in the fight? To help my fellow veteran, and it's like I get dragged back in. Once I think the fight's over, that we finally got it fixed. Nope. The soulless, mindless bureaucrats, go back to doing what the management does. Now the doctors and the nurses are great. And that's where I get a lot of these complaints, and a lot of them have been quitting because they just can't take it anymore. But you're right. Our men and women serve, and, the management puts out their propaganda. And so I counteract that propaganda. And occasionally I testify on the Hill, and those who only care about the institution and socialized healthcare. And when I say socialized healthcare, the Democrats have written articles and op-eds like Bernie Sanders saying that they don't want veterans' choice. They don't want veterans to be able to, they don't like the Mission Acts. They don't like the Veterans Access Act, because they want socialized healthcare. And they feel if they can make it work at VA, they can make it work for the rest of the country. The problem with socialized healthcare is that it never works. And so to sit there and say, hey, we just need more money, we just need better management, is whether it's socialized healthcare or socialism anywhere in the world, it doesn't work. It's just because it goes against human nature. It goes against the ability to provide healthcare. And VA healthcare is the most expensive healthcare in the country. The VA spends about $23,000 per patient per year. And that's for only 38% of the veterans' care. So
that's a big number.
The other thing that's some statistics, that I counteract that in terms of the evil part, because the VA has research, they know these numbers. During COVID, they did a survey about healthcare outcomes based on delayed care, because we had a lot of delayed care during COVID. Well, 57% of all people in the country who get delayed care have negative healthcare outcomes. And that's one of the reasons why we have the access centers for not having delayed care, because 57% of the times that could be cancer that's delayed, that could be all sorts of things. So, you can't have a urology appointment, if you have a gallbladder issue or kidney stone, and you go to the bathroom and you say, there's urine in the blood, you don't want to wait 2 months before you get to see that urologist. That could be very, very serious things. And I've had that issue. I know. You want to go like tomorrow.
Right.
So, and they've done others, even the VA has done research studies that show that the best outcomes, self-reported outcomes from veterans, are in the private sector, and the worst outcomes are actually at the VA. And that's not saying all VA healthcare is bad, but once again, averages just mean that, they're averages. They're not where you're getting it. And so that's why all healthcare is an individual decision, is an individual experience. And if you're getting great healthcare, you're going to go there. But if you're not, you should be able to go somewhere else, especially veterans. You should be able to go and get the care They should be in control of their care. That's what this is all about. And so that's why, sadly, we had to do the Veterans Access Act because, I sat down with my friends in Senate Veterans Affairs Committee and said, here's everything's going wrong. How do we fix it? How do we fix it? And how do we make sure this fix is permanent? And so we are, talking to my friends who are over at VA these days and say, hey, you guys now need to start fixing it now. Don't wait for the legislation. But we need the legislation because Trump's going to be gone. 28, that's his end. Who knows who will be the next administration and what they will try to do. So we got to make it as permanent as we can and get it as permanently fixed as we can.
So just briefly, as we wrap up in a bit, I kind of want to hear about where does the Veterans Access Act stand now? And also, what are some of the good things, good changes that could happen or you expect to happen with the Trump administration now in charge of the VA?
Well, the status of the Veterans Access Act is it's been through what they call markup. So we have a bill in the House, we have a bill in the Senate. They've were originally companion bills for markup. They got slightly changed. So that's a procedural thing so they can get the floor vote. What's nice is that the White House, VA, House Veterans Affairs Committee, Senate Veterans, they're all on board on the same page. We even had it markup 7 Democrats vote for it, which is what you need to get it 60 votes. Hopefully they won't change their mind. And so with CVA, we're going to make sure they don't change their mind. And so we're in good shape. The target that everyone wants is Veterans Day for the president to sign the bill. It's going to be tough because we have things like, continuing resolutions, no potential budget, shutdowns.
Yeah.
But, we have a final version of a companion bill that's almost ready for release from the House and the Senate. And then, we're going to push it. We're going to use our grassroots. We're working with the White House, the VA, and the committees to push, and make sure we get these votes. We're briefing the Senate Steering Committee policy-wise on that to get them up to speed. We've talked to leadership staff on Thune and Johnson and floor time, and leadership staff wants this. They see this as a big, important win, and frankly, something nice to talk about that's not simply the budget, which causes people's eyes to roll in the back of their head and bore them to death. Because Americans love their veterans and they want them taken care of right.
Yes.
So we're in a good spot, but it's never done until it's done, and we got to get it done. And so we're going to continually push hard and see if we can get that floor vote and a passage the first week of November. So we're going to continue push all ends. And CVA is also partnering with AFP, and in terms of making sure that we as much muscle behind it, as much coalition support, and we're going to push until this thing is done.
That's great. And do you see any other things on the horizon with regard to the Trump administration, or maybe even the VA working better if they get more appointees in there? How do you see that in the future?
Well, we're looking forward to a couple things. One, to get them an undersecretary of health, and to go beyond the Mission Act and go beyond the Veterans Access Act, because our goal down the road is what you can do in basically every other healthcare program in the country, federal and private, which is full choice. So we think eventually veterans should have at all times the choice between, like the Senator Blackburn bill, Veterans Healthcare Freedom Act, the choice pick between the facilities and whatnot. And we're looking forward to better operations. So it's not just laws don't help, operations help. So we're looking forward with the Trump team getting in there and getting confirmed. They have better operations. So it just won't be in regulation and law, the operations. So whether it's claims, whether it's healthcare operations, and getting a hold of their budgets and getting rid of the fraud, waste, and abuse. So we're very hopeful. And of course, we have been putting on the table ideas on how to do offsets, how to reduce costs. I mean, for example, most people don't know, but there's over 900,000 non-veterans who use the VA each year at a cost of $3.5 billion.
Wow.
And so the question is, why are the taxpayers spending $3.5 billion on over 900,000 non-veterans? At a minimum, they should be, obviously they don't have VA health insurance. So why aren't rather than the VA collecting that money back, if they are VA federal employees, other federal employees, Champ VA, who have a different program. So they're always trying to get more people in the system to beef up the numbers. But that's $3.5 billion a year. That's a $35 billion offset. So, I mean, these are the things that we're always looking at in terms of why are you doing these things? It may have been innocent the way it started, but now it's 900,000 non-veterans. And that also delays the care for the veterans besides the cost. So these are the things that we're looking forward to work with the White House and the VA and to have a much more efficient, because we want VA to be sustainable. It can't be sustainable if it grows 10% a year.
Well, I do hope there's a lot of improvement there, and I'm optimistic that there could be some movement in Congress. And Darin, I really appreciate all the great work you're doing for your fellow veterans. You've been a leading voice here, working alongside CVA and our partners there, really trying to bring this home, and just been a few decades long struggle to get better care for veterans. It's so non-commonsensical to me that we have to fight for this, but we do. And you guys are leading the charge, and I hope you're super successful here in the next few months.
Well, thank you so much. And one of the things I've learned recently is how important podcasts are. More people watch podcasts.
I agree. Very, very true.
Then they watch the cable news. So to your audience out there, you can participate as well. You can go to the CVA website and learn how to participate, because grassroots is one of the key things that we're doing. Contacting your legislators, whether they're Republican, Democrat, and saying this is important. You need to vote for it. You need to be part of the win here.
Yeah, that's great. Yeah, go to Concerned Veterans for America. I think it's cva.org, and get involved. Darin, thanks so much for joining us again.
Thanks so much for having me. Appreciate it.
Folks, if you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. And always remember, liberty and freedom are easily taken for granted. Don't take it for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.